started in 2004 and now we've grown to 8 locations. Our focus over the years has been skin cancer. Although we treat everything, acne, psoriasis, rashes, you name it. In 2006, I started doing Mohs surgery, which is a very high cure rate procedure. It's a surgical procedure to remove skin cancer. And that was great, but I was always looking for a less invasive way to take care of people with skin cancer. The image-guided superficial radiation therapy, the SRT 100 Vision, has been really the latest in technology as far as the treatment of basal cell carcinoma and squamous cell carcinoma. It's image-guided, meaning you can take ultrasound images of the tumor before you start treating it. You can get a volume that's measured. As you're doing the treatments, you can look at the tumor on the ultrasound and kind of confirm that you're doing what you want to do, which is shrinking the tumor down. And that's really a nice thing to be able to show patients, that you have proof that their skin cancer is gone. Some of the areas where the SRT really shines and has a tremendous benefit for patients would be on the nose. The nose is a fairly delicate structure. Lips is another area that people are very concerned about. The area around the eyelid as well. Any of these areas they're very cosmetically sensitive areas. They're also highly functional areas. There are a lot of positives when patients are evaluating SRT 100 Vision versus Mohs surgery. The kind of no-brainer one is the pain. And the SRT, the fact that it doesn't hurt, there's no needles, there's no scalpels, is a big deal for a lot of patients. I've had patients come in that haven't treated a spot on their ear for 5 years because they were afraid they were going to lose their ear. Now patients that might have held off and waited longer than they needed to get something treated, they'll come in sooner and get it treated. They may have a small amount of anxiety around X-ray initially, but after their first few sessions, they see that all they're doing is laying there and listening to a beeping noise for maybe 30 seconds. Then they realize, hey, this is actually a piece of cake. Cure rate is comparable. The SRT 100 Vision has a 95% cure rate, whether it's basal cell carcinoma or squamous cell carcinoma. It's covered by insurance and Medicare, and that's another concern of theirs. How will I pay for this? And then the last thing is that they really want to know that they're going to look normal, at least as good as they did when they came in. And with the SRT, we're getting very good cosmetic results for these patients.